She is Dr. Hafsa Muhammad from Khyber Medical University, Peshawar. She is a molecular biologist as well as a supervisor, a research supervisor and biosafety officer at Khyber Medical University. She has a lot of trainings. She has organized a lot of trainings regarding biosafety and biosecurity in the province and has trained around 30,000 healthcare workers to deal with the COVID-19 samples and the things. So let hand over the floor to Ms. Hafsa. Uh, Ms. Hafsa, can you hear me? The floor is yours.
Yes, I can hear you. Thank you so much.
Thank you.
And am I audible?
Yes, we can hear you.
Okay, thank you. All right, thank you. So I will be talking about the public health laboratories as Dr. Amir Ikram's presentation about his institute NIH set a background for my talk today. And many of us now know what exactly is the role of the public health laboratories. So I will be talking about the importance of biosafety as being the backbone of public health laboratories and presenting our own lab, the KP Public Health Reference Lab, as a case study. So for those who are not very much aware with the public health labs or are mostly linked with the diagnostic or clinical labs, so I just want to, for them, I just want to make it clear here that the clinical lab assists the clinicians in individual patients' diagnosis, whereas the public health labs take the whole community as their potential patient and they assist the health officers in getting the right decisions to make the right SOPs, right dimension strategies in order to take care of the community health, of the public health. So a credible and accessible laboratory service is very much important in any country's capacity to investigate any kind of event that is related to the public health. And especially in case of the outbreaks, either it can be local small scale outbreaks or these can be pandemics like the COVID-19 pandemic that we all are experiencing right now. So in this scenario, the importance of public health labs become very excessively important. So the focus is to of these labs is to on the health status of the population groups. They are mainly supposed to perform reference testing, some limited diagnostic testing, disease surveillance, and as we have seen that emergency response support. So whatever kind of support in terms of diagnostics or trainings or technical support, the main public health labs can provide to different smaller scale labs. This is one of their responsibilities. They also perform the applied research. They provide trainings to not only their own workforce, but also to the labs that are under their umbrella of operations. And they are supposed to do the investigations in the public health related events. So this is the biggest responsibility, that is investigation of the public health events. Uh, while the public health labs are dealing with samples and pathogens that are high risk samples, obviously like COVID-19, if we see this as a case, so we know that this was nowhere around in the over the globe anywhere, and it's something new that has changed our perception of lifestyle and everything around us. So these are the high risk pathogens, and the public health labs are supposed to deal with those high risk samples, and especially in this scenario of newly emerging diseases. So these labs can be the high risk spots because of harboring the specimen that are of maybe of some exotic nature kind of thing, or that are new for the world, and that might be new for the local area where the public health lab is located. So there is a chance that the agents of terror can spread from these hotspots to the neighboring regions, or maybe they can cross the border to reach to the other cities. So it is very imperative for the public health labs to develop and implement the standard biosafety and biosecurity protocols, conduct trainings, and make a process of monitoring, evaluation, and retraining of their staff because of the kind of sensitive job they are doing. So we propose that a strong biosafety program makes the backbone of an effective and reliably operating public health laboratory. So as I'm presenting a case study, going to talk about the Khyber Pakhtunkhwa province of the Pakistan and the main lab that is from the designated from the KP government for being the flagship lab in the KP province to provide the COVID-19 testing. So this lab was officially notified on February 6th, 2012 as a public health lab. And this is located in the main campus of Khyber Medical University, Peshawar. And far long before the pandemic, the KP-PHRL had envisioned the need of a strong biosafety program in 2017. So right after its conception, it took the first step of constituting an institutional biosafety committee on February 9, 2017. So this was the first step in making the a strong biosafety program in place. So that IBC, they set a proper biosafety guideline. They appointed a biosafety officer and a training expert, and they also incorporated the AMP model of assessment, mitigation, and performance in its operations, because the lab has been doing was located in the premises of a university, that is Khyber Medical University. So they have already been doing the research work with and dealing with different kind of pathogens at that facility. So well before the arrival of coronavirus in Pakistan, KP-PHRL was well prepared. Not exactly in terms of the engineering controls and all that, but they were prepared in terms of biosafety to take any bigger step ahead. So the already in place biosafety program had been strengthened during the pandemic and has been continually improving with different waves that are focusing on different aspects of both biosafety and biosecurity. So initial preparedness, this is the time from the conception of IBC for KMU till the start of pandemic in December 2019. So what we did at that time, the program covers the following 5 main domains. One is the IBC that I've already talked about, and the biosafety curriculum. We have designed and developed and taught and instructed 5 different courses that are relevant to biosafety, biosecurity, bioethics, research ethics, and One Health. One Health is one of the thing that we proudly present as we are among the only few universities in the country, might be the only one, who has incorporated One Health course as the main core course in their syllabus of at the postgraduate level. And the third thing, the third domain about the biosafety program is the biosafety trainings and workshops. Fourth is the high reliability organization status for KMU. In this high reliability organization status, we have been trained by different international experts and advisors, and with their guidance and with a lot of teamwork, we have been able to work upon the soft aspects of the biosecurity program, like personal skills, job satisfaction, and human errors, and how to control these things, the behavior therapy, the human mental engineering kind of things that were targeted during the HRO practices. And the fifth thing is the IBMS Biosafety Society. This was initiated by one of the institute of KMU, that is Institute of Basic Medical Sciences, but we took it to the broader level of whole Khyber Medical University. So these are the steps that were taken well before the pandemic. And we started by doing the awareness sessions and orientation for our students, for our laboratory staff, for our faculty, and for our lab workers, where they were given a sensitization and the initial flavor of biosafety. Then they were offered to be a part of the biosafety society through the Student Resource Center. They were students and other people were allowed to take optional courses or the core courses that were about biosafety, biosecurity, and as I mentioned earlier, about the One Health as well. We also offer a certificate course in biosafety to the people who are not part of KMU and that belong to other organizations or universities or public and private sector laboratories, etc. So we, as being public health reference lab, like training and strengthening the other institutions as well, is we took it as a part of our responsibility. So we are helping the other people as well in making their biosafety system stronger. So we do offer biosafety workshops from time to time, from different as a pre-conference in different times. And the two main steps that we took initiated after this IBC constitution were the IBC form. Every student, every researcher that was supposed to going to work in the laboratories was supposed to fill up the form and make a comprehensive risk assessment of in terms of biosafety and biosecurity. And this form had to be approved. Then only then the students were allowed to go for the graduate studies committee meeting. Then the biosafety intensive training. We made it mandatory for those who have been through the GSC to go through this intensive, many hours long hands-on biosafety training before they were able to get a certificate, and that certificate mandatory requirement for being appear in the Advanced Studies and Research Board of the university, KMU. So if the students were recommended by GC and ASRB to take part in different biosafety cabinet workshops or the animal use workshops, depending upon the nature of their research project, they were offered to do that as well. After these trainings, when once the students were allowed to go to the lab and start working, they were guided from time to time by the seniors, by the supervisors, mentors, and lab directors about the laboratory biosafety rules and good laboratory practices. And this continues throughout the lab work they have been performing. In case of any incident, we have started our incident reporting system. This system is currently on its way to further strengthening, and we are trying to make it more stronger. And whenever there is an incident, we have a reporting system to continue. Then we have a biosafety outreach program through which we train different biosafety, different organizations and institute about the biosafety requirements. So here is a glimpse of our labs that have been marked with red, yellow, and green coloring. So we tried to implement the HRO principles where we could have like asked our, we have make their minds in order to do risk assessment and do the high risk work at a certain specific area and do not interfere with the areas that are dealing with the low risk or no risk areas. So in this way, we are trying to polish or set up the mindset of our workers or of our lab force about doing the risk assessment practically about what they are dealing with.
Madam,
So,
because we are short of time.
okay. Okay, yeah, I'm just going to do it quickly. So once the pandemic started, we started with the strengthening of our biosafety program from January 2020 to the present. And here what we did was initial preparedness that I have already explained. We provided training to over 30 different government organizations and institutes about biosafety, sample taking and all that thing. We set up our own protocols for doing the PCR based testing for the SARS-CoV-2 virus. And we also did the lab upscaling and upgradation with the help of different government institutions. And we made some educational videos and guideline documents that were circulated among all of the provincial people so that we okay, can you see my screen? I think I just lost this.
Thank you, Zapta, again. Great, you had a great work and we appreciate all this. But before my colleague, Dr. Mohammad Ali, announces the last speaker of the day, I just request all the speakers, if they want to publish their presentation, we are publishing a special issue of Pakistan Academy of Sciences, having only papers of the speakers. I request all the speakers, if they want to publish their paper, we will peer review it. It has a very good standing in Pakistan and abroad. So I request all of you to kindly submit your papers before the third webinar, which is 25th of April. May, 25th of May is our last webinar. Before that, if you could kindly send us your paper, we will be pleased to review it and publish it in our Pakistan Academy of Sciences journal. That will have recommendations also, one.